Don't pay for what you didn't buy. Stopping medical billing errors. Medical billing errors are alarmingly common, and patients just like you and me end up paying the price. Some studies estimate that 4 out of 5 bills contain at least minor errors, which can result in inflated medical charges. Other statistics state that billing errors result in overcharges of 26% on average. So let's talk about how these errors happen. What are common things to look out for? And at the end, we'll talk about what you can do if you think you were billed incorrectly. My name is Grace Gosnell with the Health Benefits Network, where we give you the scoop on the latest ideas and innovations about healthcare and benefits that can make your life better. I myself had this very thing happen a couple years ago. I had gone to an urgent care facility, paid for my visit as a self-pay patient, and saw the doctor with no further testing or procedures being performed. Fast forward about a month and a half, I received a bill in the mail for about $150 with absolutely no description of what it was for. So I called the billing department and informed them that I'd paid at the time of service, received no additional treatment beyond seeing the doctor, and I needed to know what this charge was regarding. The guy in the billing office took a look and told me the bill was completely erroneous, and they had actually overcharged me originally at the time of my visit. They would send me a check for the difference. These things happen every single day, and unfortunately, it's up to us as patients and consumers to advocate for ourselves and call out these mistakes. The first step in identifying and fixing medical bills that you think are incorrect is requesting a copy of the itemized bill. If you don't know what you're being charged for, it will be impossible to dispute the bill. With that in mind, let's talk about the different kinds of medical billing errors you might find, and what are some common things to look out for. Take a close look at the services being billed. Do they all match up with what was actually done while you were there? In the world of medical coding and billing, an easy flip-flop of a number could wind up billing you for something you didn't receive. A real-world example of this would be, say, getting an MRI on your knee. The CPT code for that MRI with contrast is 73722. The code for that MRI with and without contrast, so 2 scans, is 73723, a mere 1 digit apart, but costing nearly twice the price. You can also look for things like tests that you didn't undergo, or errors like if you've been charged for duplicates of the same service. The notes left by the doctor can easily get misinterpreted by a billing department. A small portion of inflated medical bills are even the result of fraud. From time to time, providers have been accused of what's known as upcoding, which is a term that means using incorrect billing codes that will increase the value of the payment for their services provided. An example of this would be in the facility fees that many hospital emergency departments will charge on top of medications given and other services rendered. These fees are coded on a scale of 1 to 5 and reflect the complexity of the care that a patient requires. A 4 to 5 would represent life-saving critical care. A patient who only required antibiotics and basic wound care, but was coded as a high complexity visit, would be a perfect example of upcoding. Unbundling is another type of fraudulent medical billing, in which the patient is charged separately for a medical treatment that already comes under one procedural code. For instance, if you went to a provider for the treatment of a deep cut and got it cleaned and stitched, a healthcare provider must charge all of them under a single code. When all of those services are being billed separately, your medical bill shoots up dramatically. Before we get into what you can do when you think a medical bill might be incorrect, I want to thank Scoop Health for sponsoring this video. Scoop Health is a strong advocate for medical cost-sharing memberships, which I've personally been using for several years to give me peace of mind when it comes to large medical events that might pop up in my life. I'd love to share more with you about how it's worked for me. I'll leave a link in the description below, so please get in touch anytime and we can talk. So now, what should you do when you believe you've received a medical bill with errors? The first thing I'd recommend is to request a copy of your medical records, in addition to that itemized bill I mentioned. That's a great start to compare what the doctor ordered and charted versus the items you've actually been billed for. Go through the itemized bill and mark line items that you believe to be incorrect, and then cross-reference those with your medical records. Once you have compiled your list of information, it's time to bring this up with the billing department at the providers that you've seen. If they are truly honest errors, they should work with you to get those corrected. I hope this information about how to spot medical billing errors is helpful to you, so you know what to look out for. On the Health Benefits Network, we have a lot of videos pointing out many of the problems with the state of our healthcare system and new and innovative solutions, such as GoodRx, single care, and medical cost sharing. And lastly, please leave any questions, comments, or thoughts you have in the comment section below. To make sure you enjoy more videos like this, please subscribe to the channel and click on the notification bell, as we'll be bringing you more healthcare benefits, news, and stories. And don't forget to hit the like button and share this video with your family and friends.